Good evening. Today I will discuss an essential law that significantly impacts our healthcare system, the Magna Carta of Public Health Workers or Republic Act 7305. This law recognizes the critical role of public health workers in national building and ensures that their welfare is prioritized. The Magna Carta for Public Health Workers or Republic Act 7305 was enacted in 1992 to promote and improve the welfare of public health workers in the Philippines. This law was developed in response to the challenging conditions faced by public health workers, including low salaries, inadequate benefits, and unsafe working conditions. Its primary purpose is to ensure that public health workers are compensated fairly and provided with proper benefits and protection, thereby enhancing their motivation and efficiency in delivering essential health services. Next is for the scope and coverage. The law covers all public health workers in the government, hospitals, health office, health units, and clinics at the national and local levels. Public health workers include doctors, nurses, midwives, barangay health workers, and administrative personnel involved in the healthcare delivery. Next is for the key mandates. Salaries and benefits provide standardized salary grades, hazard pay, and overtime compensation for public health workers. Workplace protection ensures safe and healthy working condition and mandates proper facilities. Continuing education grants opportunities for training and professional growth. Leave privileges entitles public health workers to maternity, paternity, study, and special leave benefits. Right to unionize safeguard their right to form association and unions to advocate for their welfare. Next is for the implementation of national and local level. For the national level, the Department of Health or DOH is the lead agency responsible for overseeing the implementation of RA 7305. The Civil Service Commission or CSC and the Department of Budget and Management or the DBM collaborate with the DOH to enforce salary and benefit provision. For the local level, local government units or LGUs are tasked with ensuring compliance at health facilities under their jurisdiction. LGUs must allocate funds to support the additional benefits mandated by the law. Lastly, for the role of stakeholders, public health workers, union, and professional organization advocate for the proper execution of the law. NGOs and advocacy groups monitor its implementation and raise awareness about public health workers' rights. For the evidence of implementation, hazard pay during COVID-19, the government granted hazard pay to public health workers during the COVID-19 pandemic under the Magna Carta, reflecting its relevance in ensuring health workers' welfare during emergencies. Provision of additional benefits. Several LGUs such as Cebu City and Davao City implemented salary adjustments and provided special allowance in compliance with the Magna Carta, especially for the barangay health workers. Improved workplace condition. Health centers in various regions have undergone renovation and upgrades driven by the Magna Carta's provision for safe and conducive working environments. In conclusion, the Magna Carta for Public Health Workers is a cornerstone law for protecting and empowering our public health workforce. It ensures fair compensation, better working condition, and access to professional development, directly impacting the quality of healthcare services in the Philippines. Its proper implementation relies on collaboration between national agencies, LGUs, and stakeholders. By prioritizing the welfare of public health workers, we strengthen our healthcare system and ensure better services for every Filipinos. That's all. Thank you for listening.